G'day. Hi from Sydney, Australia, and the Applied Anthropology Network representatives of the Australian anthropologists.
The goal of our discussion was to explore how to center neurodivergent medical practitioners in the medical education continuum. But for instance, something that we are dealing with at the moment is that when you are an education provider, of course, what you need to design is for the doctors, for clinical education, but as a second step for the patients. But we are dealing with a higher number of trainees who are diagnosed with any type of different, So we need to think about also the way we teach, all the resources we put together. So there are two different layers for us when we work. We need to think about the patients because we need to teach the doctors how to behave, with these patients. But also we need to remember that some of our doctors
are also those very people.
Exactly.
For it to be the most effective, we need to go back to the human and understand who they are and how we can help them, because that's really what medicine should be, right?
Yeah.
Particularly at the doctor, the interface of the doctor and the patient.
Primary care.
Yeah.
Just start with the basics. If this is a condition that is for, if this symptom that this person's having, we know that 98% of people who have that symptom have heart disease, then it's probably heart disease. You need to rule out all the likely things before you deal with the unlikely or the improbable.
We're going to put horses, not zebras, just to remind us.
But in a way, horses, not zebras is not about the periphery. It's about the opposite. It's about, and it forces people on the periphery to go through a lot.
In futures, we use this idea, it's called 100 ways, 100 things we know are true. And we list all of those, and then next to them we go, what if the opposite was true, to help us reframe the solution from a different angle.
What is considered a good doctor?
Yeah.
Because all that stuff that we're talking about, holistic and empathy and personable and all that sort of stuff, and great communicators, is plus all the technical stuff.
Yeah,
there's a lot. That's a big,
but that's
a big ask of a
we are
person.
Considering a good doctor.
Yes.
But I can't
We're in
think
the
of
centre.
And it's also not measured.
Agreed.
If we think about the things, if this doctor exists in, say, a large healthcare setting, whether that be a hospital or maybe a allied health kind of practice that has a central head office, there is no fast KPI for any of those things.
We all have different learning styles, for sure,
Yeah.
And in this space, learning need assessment, in most of the cases, they think about what topic they should learn to become good doctors. But it's not just about that, especially if we are talking about neurodivergent students. And this is for organizations. They should make learning need assessment compulsory, and they should do research in this. What kind of cohort of students do we have, and based on that, what type of resources or tools or activities we need to prepare. As long as it does not become a label, meaning that if they want to pursue that specialty, they should be given the opportunity to.
So that's a principle. It's a label. It's not a label. It's a guide.
Yes, to navigate the system.
To navigate the system. Yeah.
Because
there's a lot of resistance in the public, still.
With stigma,
It's
a stigma.
I think we are going through different, trying to fight different stigmas at the moment, and this is, let's add it to the group, I would say.
The solution we landed on was coming up with a learning needs assessment for medical practitioners. And the way that anthropologists would approach this, if it was led by us, would be to place doctors at the centre of the system, viewing them as an evolving person whose needs iterate and change throughout the life cycle of what they learn. And this would involve redesigning the assessment, looking at the whole ecosystem and the interrelationships of doctors, patients, students and suppliers. It would involve a contextual understanding, nuanced questions, and it would look at how do they learn and how might we adapt content, and also not looking at this in terms of only a numeric assessment but other qualitative aspects.